Good morning. So I'm Catherine Reed from Lilly, and I was part of Work Package 1, which was the executive committee for Roadmap. So I'm just going to tell you a little bit sort of about the roadmap journey from maybe a bit more of an industry perspective and sort of what we think we should do going forward. So obviously in the last number of years, we know that there's been an expansion in how we're thinking about Alzheimer's as a disease, and there's very much a move to understanding earlier forms of the disease, even preclinical, and understanding where the best target is for a new drug intervention that will delay progression, either delay onset of disease or delay progression of disease. And that's really caused a big gap in terms of what data is available. Much earlier on in the disease, there's much less data available, especially when people who are not yet patients are just in the normal healthcare system. So there's this gap between what regulators want to see at the end in terms of the endpoints, measuring cognition, function, global measure, or even quality of life. And actually, none of those are captured at the earlier stages of disease, when we're more thinking about biomarkers or some way of screening for disease. But the reality is that when we come to evaluating new treatments, we need to use real-world evidence. We use it to understand the natural history of the disease across the full spectrum of the disease, which is now the aim, and also to see how we can use short-term evidence to understand longer-term outcomes. So, for example, in a trial that lasts 18 months, what does a change in cognition mean? How does it affect time to development of more severe dementia or time to institutionalization? So that's where modeling will come in and which we use real-world evidence, because we just don't have that sort of data available in shorter trials. So that really evolved into the need for roadmap to really, there is a wealth, well, there are a lot of data sources out there. How can those best be used? Are they useful for demonstrating that we can use that for disease modeling? How can that be used to really, how could those potentially be used if we had a new drug in the market that we wanted to show the value of? So this led to Roadmap 1. So, I mean, there's a common theme through the talks around the diversity of endpoints that there are out there. These are all what we knew before. The long time frame for the disease progression, and this need to understand the link between short-term changes and longer-term outcomes. And through Roadmap, there's a number of sort of key deliverables, I think. I mean, there have been a lot of work gone into this last 2 years. And to summarize these key deliverables is a bit of a shortcoming, but here we are. So you heard yesterday from Work Package 2, who looked into the outcomes, the most relevant outcomes. And we've been able to identify and prioritize those outcomes from a number of different perspectives. And it was very interesting to see the charts that they showed where although there is a good overlap in priority outcomes across people with Alzheimer's, their carers, and healthcare professionals, there also are some differences, and that the priority of those outcomes change over the evolution of the disease. When we look at those priority outcomes and what is actually available in the data sources, that's where we really understand where the gaps are. So it's not just about actual gaps in the information that's currently available that when we want to highlight these outcomes, but also in the quality of the data that's available. And one of the exercises with the data cube has been able to do that to some extent, to show what data is available for outcomes across the different disease spectrum and some understanding of the quality of that data. And you're going to hear about the data cube later on. So there was one of the other work packages looked at validating existing disease progression models using available data, and there were, as you might expect, there are many challenges with that, and some variable success about being able to use the data sources that we had accessible to us in order to replicate disease models. The systematic literature reviews, which are a real core evidence, scientific evidence generation for us, and they're usually the core of all the work that we've done. And we're being able to provide and hopefully publish on some current literature reviews around disease progression models, resource utilization, and quality of life. But a common thread through all this has been the multi-stakeholder engagement that we've had through Work Package 6. So not just with and we heard clearly as well yesterday from the Alzheimer's Europe Working Group that their voice is important as well. So we've been able to utilize Work Package 6 to really get feedback on all of these, the progress and the final deliverables on all of these aspects of roadmap. So what does it mean going forward? So I think what we've really identified is that there is a need for good quality data in Alzheimer's disease, which will inform disease progression modelling and ultimately economic modelling as well. And we really have been able to foster a dialogue between stakeholders. So we really see that it's really going to be important to have a multi-stakeholder engagement in defining the current needs for RWE and moving that forward. And I think it's, clearly as well from the Alzheimer's Europe team and from the EXAG group as well, is that they want to be engaged. They think that they will add value. They get value from it. And also ultimately, it's going to be with a RWE strategy that engages all the stakeholders, it's going to actually deliver the right structure and the right outcomes that are needed. I think also we need to ensure that there is a common model for an RWE strategy. So that's going to take into account the clinical, legal, and the ethical aspects, and that we need to have some sort of core protocol that everyone can buy into. So that's in terms of how we collect the data, what type of data we need to collect, and what countries are most viable, how we integrate that within existing healthcare systems, as well as patient cohorts. And that ultimately will be feeding into modelling innovations around disease progression model across the full spectrum of the disease and how we actually achieve that. And we really need to get alignment on understanding what a minimum data set would be in having identified the priority outcomes from the different stakeholders. How do we condense that into a manageable and realistic form of outcomes that can be measured across different systems, different sources? And how do we translate the outcomes, which so far we've defined as categories or domains, into actual measurements? What are the actual measurements that should be collected? I think those were the main things. I think the main theme through all of this, so these are that we need to capture better quality data, that we need to be able to integrate it with already existing good quality data, and that we can't do this in isolation from an industry perspective, is that we need to collaborate with academics, with HTA, regulators, patient associations, clinicians. So it needs to be a combined effort in order to move forward with the findings from roadmap. Thank you.